Hi, everyone. Can you hear me? Is this on? Yes, I think it's on. Hi, my name is Xochitl Sanchez. I'm the director of the Action Secretariat. We're a global health advocacy partnership, and I'm one of the panelists today joining you from Washington, D.C. And I'm excited to welcome you to the session, Civil Society and Youth Engagement for the Global Financing Facility in 2024, Equity, Access, and Accountability. We have participants from all over the world today who are joining us remotely. So let me go ahead and introduce you to our moderator today, Oyeyemi Pitan. She is the Executive Director of GEM Hub Initiative in Nigeria. She is also a representative of civil society on the GFF Investors Group. So I will hand it over to Oyeyemi.
Hi, Xochitl. Thank you for that beautiful introduction. Hello, everyone. Thank you for joining from across the world. We are so excited to have you in today's session. This is a specially curated event for civil society organizations, and I must sincerely appreciate the World Bank, the GFF Secretariat, the NGO host, that's PAI, the Global Youth Platform, and everyone that has actually made this event possible. This session is about the Global Financing Facility, Civil Society Coordination Group, and how we have been able to contribute to equity, access, and accountability for the health and well-being of women, children, and adolescents. And so briefly, I would just like to take us through who we have, who is CSCG. We are a global network of over 680 civil society organizations and youth-led organizations advancing sexual and reproductive, maternal, newborn children, and adolescent health and nutrition. Through our community engagement and leadership, we have contributed significantly towards the progress of achieving health equity. We also drive accountability for health and nutrition outcomes, as well as for human rights and social inclusion. This is made possible because civil society and youth organizations work with communities. We understand gaps in health service equity, quality, and access. We also convey this real-world data to policy and lawmakers, as well as duty bearers, to shape policy and budget priorities at subnational, national, and global level, with a focus on amplifying the voices, perspectives, and priorities of women, young people, and communities facing exclusion and discrimination. We promote domestic resource investments, demanding for more resources and better use of resources for health. We also monitor progress and drive accountability for the rights and results at all levels, including for adequate financing, supportive policies, and access and equity of sexual, reproductive, maternal, newborn, child, and adolescent health and nutrition, information, and services. We would also like to remind you that our Deliver the Future Resource Mobilization campaign is still on. Of course, the support is still needed to enable the GFF to reach more communities and provide essential healthcare and nutrition services in countries it supports. Now, the target is to raise $800 million to unlock $20.5 billion of aligned financing of prioritized national health plans in 36 low and middle income countries. This number is actually still counting. We have raised a little more than half of the targets. Of course, we need to reach the target, so every contribution counts. So without further ado, I would like to introduce the panelists. We are going to have a very rich discussion this morning, and I would like to introduce the panelists. We have Chijedu Moyo, who is joining us virtually from Zimbabwe, to give us a perspective of youth leadership in country-led GFF processes. She's the Executive Director of Lunia Center for Youth in Zimbabwe. She's the CSCG Steering Committee member. She's a Global Youth Platform member, as well as the GFF CSO Hub grantee. Let's welcome Jedu. We also have on the panel who is going to be giving us, perspective from prioritizing gender equality and social inclusion for health and nutrition. That's Tansnia Ahmed. She's joining us from Bangladesh, and she's also joining virtually. She's the project manager, CIREC Bangladesh. She's a CSPG steering committee member as well. Let's make her welcome. And of course, we also have another civil society organization leader, and she's going to be giving us perspective on achieving sustainable financing for universal health coverage and nutrition. Leonara Bimfi is joining us from Kenya. She's the SPARC Country Engagement Officer for AMREF. She's also a CSCG Steering Committee member. She's a CSCG Health Financing Working Group co-chair. And last but not the least, Xochitl Sanchez. She's there with you in DC. She's the Action Secretariat Director in USA. She's also a CSCG Steering Committee member. She's the CSCG Accountability Working Group co-chair. She's going to be giving us from the perspective of accountability for meaningful engagement at country level. She's also an example of CSCG and global engagement. So let's make our panelists welcome. Good. So we go straight to the questions. Jadu, we would like to hear from you. Being a youth leader in a country where we have, GFF processes going on, how are you and your organization and networks successfully empowering youth to engage with initiatives like the Global Financing Facility? And could you share how community-led initiatives like the Lunia Center for Youth contribute to improving health outcomes for youth and adolescents and everyone else in Zimbabwe? Over to you, Jada.
Thank you so much, Oyemi. I just turned on my camera so that people can see me, but may I ask to switch off my camera as I speak for bandwidth problems. So I'll switch off my camera now, and thank you so much. So I'll share how, as the Lunia Center for Youth, first of all, we prioritize youth advocates that are informed. So what we do is we train young people to understand our national health processes, especially the National Health Strategy and the investment case for the National Health Strategy. These are very important documents that guide how advocacy is done and domestic resource mobilization is done, especially also including how resources are allocated. So we train young people to understand those documents on top of comprehensive sexuality education on its own. And we also organize young people for GFF processes and other national health processes in general through engaging them and making sure that they are well aware of these processes. For example, the reproductive, maternal, neonatal, and child care plus nutrition processes that are happening at country level, because most of the young people would be trying to come up to the occasion, but they won't be having information about this. And what we do is we also create space for young people, in high-level national health processes. For example, the pre-budget consultations that happen every year in November. We make sure that young people from all parts of the country, they are well informed about this process and they are well informed about how to engage in this process. We come together prior to these meetings and to make sure that when young people go to these meetings, they are then well aware of what is going to happen, how is the process going to happen, and what are the collective issues that we are raising. Because if we raise issues in a collective manner as young people, we are bound to be heard than when we raise issues when we are not in a collective manner. And we also not only work at national level processes, we also go down to the communities and create demand, because we know that the GFF invests money in for young people, adolescents and women to access services. So we make sure that we train young people and we ensure that there is demand creation for these services. So we do continuous engagement, and we do this in a way that young people are comfortable. We use sport, we use focus group discussions, and we use various stakeholder engagement. It could be parent to children communication, but we use whatever young people are going to be comfortable in terms of participating in these processes. And also, we can't talk about young people and not talk about using mass media as a mass communication tool, because media is a mass communication platform. So we also use social media. We try podcasting, especially for young people that we can't reach physically, but they've got a bit of data. And we also try to foster relationships between young people and the relevant stakeholders, because for young people to be able to engage on their issues that are affecting them, and for young people to be able to be heard really in these policy making spaces, they need to have good relationships. So as the Lunia Center for Youth, we make sure that we are that bridge between young people and the relevant stakeholders, and we are grateful that, you know, we are supported to do that work, and we continue to do that work. So in terms of how community-led initiatives like the Lunia Center for Youth contribute to improving health outcomes, what happened is these community-led initiatives, like I was saying, you know, they are done from the communities. They are done from the ground up. So them being done from the ground up, they shape the perfect health service delivery, you know, that every person deserves. So working directly with the communities and linking with service providers, relevant authorities and policymakers at national level, we make sure that we shape the kind of service that we want, and we inform how it should be provided. So advocacy is done from the ground up. And the fact that young people are at the forefront of these initiatives, we make sure that the health services that we are talking about, that we are advocating for, they are informed by and they are shaped by the young person that needs to receive these services. That's why you find that most of the work that we do, we work directly with the young person in the community. We don't, you know, have this desktop research about young people. We talk to young people, we engage young people, and that way it improves the way health services are improved. I'll make an example of how we had inconsistent policies in terms of age of consent to sexual activity, which was then affecting how young people were accessing health services, because it was saying that an adult is a person who's 18 and above, but somebody who's 16 can access sexual services. So that would make it hard for a young person who's had sex at the age of 16 to go and access a service because they are not yet 18. So we had a lot of, you know, challenges with young people who are 16 and 17 were having sex but could not access services. But because we worked with young people directly, and, you know, we are happy to say this year we managed to have the harmonization of those policies. So we really do, you know, advocacy and engagement from the ground up. And this is how, you know, health services are improved, you know, for everyone else in Zimbabwe. Thank you so much, Oyemi.
Thank you so much, Jado, for actually taking us through the process, working with the young people, you know, at the grassroots, working with the young people, carrying them along, you know, training them, understanding what the issues are, and then training them to actually also influence, you know, policies, influence decision-making, influence how programs are being done for young people. That's so beautiful. Thank you so much for the work that you do with young people. And so we'll go straight to the next panelist. I'm going to be inviting Tansnia Ahmed from Bangladesh. Tansla, how can we ensure that gender equality and social inclusion are prioritized effectively, you know, for the health and nutrition initiatives, drawing from examples and experiences such as in Bangladesh? Over to you, Tansnia.
Thank you so much, Remy. Am I audible?
Clearly.
Okay, thank you so much. So, as you are talking about how take it these things, especially about the gender equality rather than equity and social inclusion, when we are trying to connect different kinds of gender diversified people, it sometimes connect with a very common story, a story where maybe sorry, a story where it's very clear that when adolescent boys and adolescent girls in the same room, they are having their lunch, but the big portion is having by the brother or boy, and maybe the leftover things is taken by the girl or the daughter. So this is a very common story. Again, if come to the accessibility of health services, the story is also very common that even the time of the menstruation or having some sort of malnutrition thing, the girl is not having take proper nutrition or not or even having the services time of the menstruation, rather than in terms of very general maybe seasonal fever and other thing, boys even get the better services. So I think this story is not only about the Bangladesh, rather than this story is very grassroots level story where we already are working on the cultural level things and socially or even the viable all of the gender diversified people, because there's this in this era of the women empowerment, in this era of the gender orientation or diversification, people still thinking are very very cognitive way that how even they are taking their way rather than even ensure the equality. And in terms of the equality, if even if the justified or justification is not clear, in that point the equality cannot be happen, and it will be remain again the judgmental. Just an example, if in terms of the menstruation, again the bucket of the water is much needed for a girl, again maybe a less water is taken by the boy, because the menstruation time is really very sensitive for the girl. Even there are some changes, there are physical and mental changes happening on that time. So there are several times of things can be identified, or even the making more vulnerable for a boy, for a girl, for a transgender, intersex, and all other gender diversified people. But if really we want to go up with the program implementations or even the policy recommendation, then alas, we have to say, or we have to admit that the thing is there, the implementation process is there, but the fact is these things are not addressing properly. But still the government is trying to capture all of the things. If I just going to give an example with the GFF, as we all are working with the GFF, and I'm representing GFF today with the CSCG. So it's an example that's with the support of GFF and government is taking several kinds of initiatives. As an example, a school-based program that is taking over by the Director General of Family Planning and Director General of Health, which is, more ignite with the Ministry of Health. They are taking one of the program that is, where equality, equity, and efficiency has been triggering out with 3 dimensions. And with that program, nutrition, sexual reproductive health, and gender equality has been ensured throughout that program. And that program was the best example because all of the 3 part of the division of the country has been taken over from 2016 to 2021. But alas, after that, what will be happen? What is happening now? Still, it's done, because after project completion, we have to think about how we are going to sustainable of this program. And one of the very important example is DGHS has been taken this program as their own program. They has allocated budgets from their operational planning, because this is really very amazing to going to look at all of these things. So maybe that is the best example what we are now taking. But for my way, what I'm taking from the grassroots level, there are many more suggestions. We have to maybe more focused on the gender sensitive policies, because the gender word or gender things, gender orientation, disparity are still in not invalid way. So we have to think about how we can integrate the gender things, gender, all about the points of gender may be integrated in the policy, so that the policy will be prospered and taken in a very positive way. Secondly, we have to think about the contextualized local initiatives, so that the initiatives not only for us, for the maybe in our target way, rather than in more owned way from the grassroots level. And thirdly, about several kinds of capacity building program, and fourthly, about the maybe culturally tailored program, so that the culture, the people, the community, even the policymakers who will be equal in everywhere in the contextualized way, and also be communicated with the further more discussions. So I want to stop here, but if you have any questions or comments, I'll be back and try to respond to you. So over to you, Amy. Thank you.
Thank you. Thank you so much, Tanzania. Thank you for sharing the fact that there are so many factors that contribute to gender inequality. So beyond the policy, implementation is definitely key, and it's dependent on availability of so many, infrastructure, for example, basic infrastructure, and also other enablers for gender equality. And of course, at the end of the day, sustainability of any program. So thank you for sharing the work you did through GFF, but sustainability of any program is actually the key, and it takes everyone to be on board. Thank you so much. So we go straight to the top panelist. That's Nyonara, who is also joining us from Kenya. Nyonara, in the context of achieving universal health coverage, what role do you see for civil society and youth in innovative financing mechanisms, and how are they implemented at country and grassroots level? Over to you, Nyonara.
Thank you so much, Oyeyemi. I hope you can hear me.
Clearly.
Okay, all right. So personally, I think in the pursuit of achieving UHC, the CSOs and youth-led organizations actually play a very critical role in shaping and implementing, innovating financing mechanisms, and not at the national level only, but at the grassroots levels, because they sit in those communities and they know the problems that the communities are going through. So they play as advocates, they play as implementers, they ensure that their health financing mechanism will prioritize equity, accountability, and also ensure that the community is participating as the decisions are being made. So youth-led organizations also have this specific niche where they come with fresh perspectives and energy, innovative ideas. And when you give them a chance to sit at the table, it makes a difference, a very big difference. So for Kenya, I would speak about Kenya. So Kenya has a decentralized governance structure with 47 semi-autonomous counties, right? So it presents a unique opportunity for localized health financing intervention. The one thing that I've seen benefit the country a lot, and it happened across 20 countries, was a capacity building initiative that was done by Joint Learning Agenda. So they came in, we were able to train people at the national level. However, we went further to train people at the county level. And this has shown tangible successes, because now you're involving the community from the grassroots level. So we had, incidences of increased budget allocation at the county level. We also had, the confidence and budget advocacy skills improved tremendously. There's something that we do in Kenya that we call facility improvement funds, and there are counties that have actually enacted this legislation. We had them confident enough to have political engagement between the CSOs, the youth-led organizations, and member of county assemblies. And we also have a national health insurance fund in Kenya. And these people were able to have those conversations and articulate what the problems are at the grassroots level. So I think it's very important to involve the civil society organizations and youth-led initiatives. So because they have the skills now to engage in budget analysis, advocacy campaigns and policy dialogue. And they will be able to hold the government accountable for the commitments that have been made in terms of increasing the domestic resource mobilization to address health issues and nutrition issues. So when we talk about the collaboration, it's been touch and go, and I think it's important that all countries acknowledge the role that civil society play and at what level they play, and the contribution that they have towards the changes that we want in terms of health financing, and not just health financing. We're talking about financing health, and health is very vast. When you're talking about health, you have to talk about health for women, for children, adolescents. You have to talk about nutrition. You have to talk about education. You have to talk about agriculture. All these things they have a meeting point. So you cannot support one without the other. They have to work together with the civil society and youth led organizations. And it's easier to have these people who are at the grassroots level contribute to the design and the implementation and monitoring of the innovative financial mechanisms that prioritize the needs of the community. So once you have the people working at that level, it's easier to have synergies and use of money and resources in a way that supports the country's needs. It's not a copy and paste kind of approach. So with that experience, one of the challenges that we currently have with the empowered CSOs and LYOs is, in terms of funding, there's lack of funding and focus on how they can help the country move forward. So as I finish my point, I'd like to say that, we have noticed that the civil society organizations and YLOs have a very big role to play. And we would urge, that the international community also recognizes this. And we are calling upon, that investment to strengthen and deepen their capacities in budget advocacy and health financing monitoring to unlock some of the new domestic resource investments that we require to move most of the countries to achieving peace. Thank you.
Thank you so much, Leonara, for sharing, how you've been able to work with the young people, the youths, as well as civil society organizations, the expertise, the experience of the old and not too old, as well as the expertise and creativity and innovations of the youth in coming together for health financing and giving us the Kenya experience on how you did not only just, engage at the national level, you actually also train CSOs and YLOs at the grassroots. And together, everyone is trained and they are able to actually track, the financing for health budgets, and ask for accountability. Thank you so much, Leonara, for sharing that beautifully well. And so we'll go to the fourth panelist. So Chill, on ground in DC. And so Chill, from experiences like those from your networks and within the CSCG, how can civil society and youth engagements strengthen accountability at country level within global health initiatives? Over to you, Sochi.
Thanks, Yemi, and hi, everyone. Again, great to be with you, Sochi Sanchez. I'm the director of the Action Secretariat, and I'm also part of the steering committee and co-chair of the Accountability Working Group. So there are many ways in which we've seen tangible impact and benefits that accountability work at the country level has had, not only on accountability of the GFF, which obviously we're talking about today, but a number of other global health institutions and mechanisms that have led to improvements in governance structures, in implementation and tracking of results, and ultimately helping more effective and efficient use of not only funding, but deeper engagement, greater alignment, and increased impact. So for the GFF, I think on a practical level, the work towards realizing the outcomes promised by the GFF is going to require robust accountability mechanisms. And it really becomes pivotal not only in guiding us to crucial benchmarks for measuring our progress, but in achieving goals of inclusive and equitable outcomes, right? And it's pretty clear to those doing the work that collaboration for accountability is important, as there are these symbiotic relationships between civil society organizations, youth-led organizations, governments, institutions, private sectors, multilaterals, and other stakeholders that really demonstrate the power of accountability in also fostering that collaboration and increased impact. And so I'll just share a few examples of that with you all to really kind of make the point of how crucial it is to also have this accountability work as part of all of these institutions and processes. One of the things that we saw, so with the CSCG, as you've heard, is we've developed tools with civil society to improve accountability, right? Whether that was through the development of scorecard guidelines that we did, various then examples of scorecard or other accountability tools at the country level, and then using those examples to then use in other countries, right? So even like that south to south and country by country kind of sharing of lessons learned has really been critical to the accountability work, because as one does work in one country, it kind of reinforces the work that is done in others. Maybe again, one example that I'll say, and with like partners in Tanzania, HDT, who really lead that group of civil society doing the work in country, they've oftentimes used things like policy briefs, right? Data collecting from like DHIS2, which is the District Health Information System, by quarters to really analyze what's going on, showing the performance of different regions, right? And then, going on to make recommendations. And so again, the work of accountability at that level is really important to make sure that this continues, right? To make sure that when needed, things course correct, because at the end of the day, we don't want to get towards the end without necessarily saying like, are we going to reach our goals? Are we actually going to make this progress? Another example to share with you, a few years back, Nuru Health Youth Health Network in Uganda led a 3-district pilot program of something called iReport, which is an innovative community-led monitoring system tool that enables youth people to develop key indicators and collect that data. And essentially that data on sexual and reproductive health service delivery in tandem then helps us realize where are those gaps and then be able to address them, especially in the engagement with decision makers and provider of these service delivery programs. So this isn't a direct example of how youth community-led monitoring is an important piece of kind of like the accountability that ends up happening, that not only do we do community-led monitoring for the sake of actually being able to do that work for the project, but it also ends up empowering community members, right? Like the inclusion of young people has that impact in terms of helping them take the lead to identify and routinely monitor those services and ultimately be able to kind of take that forward in terms of improving. So in this case, iReport, which again is this digital monitoring, community monitoring platform, really allowed for some improvements in the program. And again, can share more on this because we definitely have a case study on this, but it really led to, I think, a number of the health facilities really committing to displaying patient care and kind of like what was the time in waiting areas, right? And like helping improve that. How were these facilities really designating space for youth? And so there's a really, really tangible ways which this accountability work is actually leading to changes at the country level. And again, I'll give one more example because there's so many. And again, the work that civil society and youth in particular is doing on the ground with GFF to kind of holding this accountability work is crucial. So the National Youth Alliance on Reproductive Health and Family Planning in Senegal also launched a youth accountability platform, right? A tool allowing users to kind of leverage that data to identify issues and kind of direct actions that districts could be taking. So collected the data, analyzed the data, developed some of their own kind of health system scorecards. And so again, this work, the use of evidence at the community level, and in many times led by youth, really was directly impacting how health decisions were being made. Some of the districts, some of the municipalities ended up increasing their budget to support certain services and promoting that health and nutrition and adolescent work that youth are doing more into their systems. So all of this to say that, as we're thinking about accountability, as we're thinking about community-led monitoring, it needs to be ingrained in the work that we do, right? Like oftentimes you talk about, how these programs come into play, you do the negotiations, you get the money in, you're doing the implementation, but there's a loop. And part of that loop is accountability. And again, at the community level, led by civil society and youth, that really can kind of take this work forward. So I know we're gonna have a further discussion, but I just wanna say that it's so important to make sure that is included within the work that we do around global health institutions, I think in particular for the GFF. And so I think making sure that the GFF donors that are contributing, other governments and institutions working on the ground really make sure that inclusive community-led monitoring and accountability is at the core of how you're planning these projects and implementing the work, because ultimately it's just going to make for more progress and impact on the goals that we want to achieve. So thanks.
Thank you so much, Sochil. Definitely, I allowed you to talk because you were actually bringing out the issues and, amplifying the work that young people and civil society organizations do in the communities. And thank you actually for sharing, different examples of the work that young people, youth-led organizations actually taking up in Senegal and even in Uganda. And that's so beautiful. And thank you for sharing the fact that accountability is even also beyond the financing, right? It's across broad. It's also about all the resources available. So we are going to, I'm just going to give you all our panelists. We are moving straight to the experts panel, right? So we have our very own Mati from the GFF Secretariat. She's the Senior Partnership Specialist. She's also the CSO Engagements Lead Global Financing Facility. Let's make Mati warm. She's joining us, virtually. We also have Christina Wags, our own Christina Wags from GFF NGO Host. She's the Vice President, Global Advocacy and Programs. She's GFF NGO Host Team Lead, CSCG Coordination Unit, PAI USA. You're welcome, Mati and Christina. And so we'll go straight to the questions. Mati, how and why is the GFF investing in civil society organizations and youth? What does it bring in terms of outcomes? Over to you, Mati.
Many thanks, Yemi. Good morning, good afternoon, everyone. It's great to be with you virtually. Sorry, I could not be there in person. It's just hearing everything that has been said before, it's really important. The title itself of the session is showing the importance of civil society and youth. And it underscores the essential role that CSOs and youth play in driving equity, access, and accountability, particularly for the most vulnerable populations in our partner countries. A lot has been said already by Chedu, by Tasnia, and also Sochil. I really, really love these examples. And this is exactly everything that has been said before. It justifies the why, right? The why we collaborate with civil society and youth as partners in making sure that we drive this agenda for women, children, and adolescents. And it's been a journey. It's been a learning journey, almost 10 years. So I think it's really, working and collaborating with CSOs and youth as equal partners. And our investment is guided by the GFF CSO and youth engagement framework, and spans across many, many areas. The first one that I'd like to talk about is the enabling environment. We want to make sure that civil society and youth have voice and representation in their countries and at the global level. What does it look like at the country level? We make sure that we facilitate country dialogues between CSOs, youth, government partners, World Bank staff, GFF liaison officers, as well as country focal points, creating this enabling environment for civil society and youth to engage in GFF national processes. It's really essential to have them sit in the country national platforms, feed into and shape reproductive maternal child health and adolescent and nutrition policies, just like Sochil was saying, and ensure there is transparency and accountability around the investment and delivery of services to those most in need. So it's really, the first is to have voice and representation, making sure that there is this enabling environment. The second investment that we make is really to ensure that civil society and youth are contributing to the health financing agenda. And this is not just a GFF. It's not just a GFF engagement. It's also an investment that we are doing in collaboration with Global Health Initiative partners, the Global Fund, Gavi, UHC 2030, and the Partnership for Maternal, Newborn, and Child Health. So this is the joint learning agenda. The first phase just closed, and we were in Nairobi a few weeks back just to hear from civil society partners who engaged in this, working to make sure that they have a place, they have a seat at the table when it comes to budget tracking, when it comes to increasing domestic resource mobilization, when it comes to influencing members of parliaments. And this is a very big investment and something that we really want to continue focusing on. Another piece of work that we have started and that is going on is the ADLAB project. It's an implementation research project that we are doing in partnership with members of the youth platform that might be in this meeting, and they are driving the how we work with civil society, with young people in partner countries to drive the adolescent health agenda forward, and to make this in through implementation research across a few select number of countries. The biggest chunk of our investment is, and I will let Christina talk about this, is really the core investment that we have through the NGO host through PAI. Many examples that have already been featured by Chedu, Tasnia, and Sochil. And these investments have already yielded quite a few outcomes. There is still a lot to learn from what we're hearing from country, but we have outstanding progress when we hear, community monitoring mechanisms that have been set, established by young people, by adolescents, when we hear increased budgets thanks to the involvement or advocacy of CSO partners, whether it's in nutrition or whether it's in adolescent health, it's really showing the outcome and the potential of this investment at the community level. So it's really the big piece, which I will let Christina speak to. These are not the why, but also the how we work with civil society. There's also one, I would say, cross-cutting across our work, our operations in the GFF. It's really making sure that we mainstream civil society engagement across operations, making sure that, through this country dialogues, whenever there is a new investment case, whenever there's a new World Bank investment in country and joint World Bank GFF investment, we sit with civil society. We see what is it in their communities, what are the issues that CSOs and youth see that need to be integrated in investment cases. And this is actually, we have a few examples that we can speak to. One was already shared by Sochil in Senegal, the community monitoring mechanism that started as a community scorecard in one of the GFF focused regions has now been adopted and is used by the national government and contributes to not only collecting data, but making sure that this data is transpiring and also done really in collaboration, transparency and collaboration with government partners. The Tanzania example is also great on disbursement linked indicators and performance issues that are being monitored by and with civil society and district health teams. So these are just a few examples of how we work with CSOs and youth. And, it's just, as I said before, it's really it's a learning process. And I would just close by reiterating that our commitment to equity, access, and accountability remains even stronger today that we start seeing results. It remains stronger than ever. And this is particular through our CSO, our collaboration with civil society and youth-led organizations. We will continue sustaining the support. We will increase the ambition, learning from the so many rich experiences that are coming from the ground and scaling up what works as well. I'll stop there. Back to you, Yemi. Thank you.
Thank you so much, Marty, for giving those very sunset examples of how the GFF has been supporting civil society organizations and youth. We'll go straight to Christina. Christina, what are the goals, progress, and outcomes from GFF CSO and YLO investments over the past 2 years? Over to you, Christina.
Great. Thank you so much, Oyemi. Can you hear me okay?
Clearly.
Great. Thank you. I live in DC, but I'm actually calling in from Tanzania because, we have these crazy schedules and you may hear a beautiful spring rain in the background. So I hope you can hear me okay. Thank you so much to all of my fellow panelists. It's such a privilege to be here today. As Oyemi said, my name's Christina Wags. I am the Vice President for Global Advocacy at PAI. And today I'm wearing my hat as a representative of the NGO host. PAI was very privileged to be selected as the NGO host organization for civil society and youth engagement with the GFF. As Madi mentioned, there are two core functions here that we provide, which is that we have the privilege of hosting and coordinating the civil society coordinating group, CSCG, which was the group that Oyemi introduced so beautifully at the beginning of the panel. And this is a vibrant network of over 700 now and counting civil society organizations, youth-led organizations, and advocates who are working at all levels, from the grassroots to the district, national, and global, advancing health and rights and accountability within the GFF structure. We can talk a little bit more about that later, but I wanted to say when we think about outcomes, I think we need to think about what this group collectively has achieved over time. They meet regularly. We meet once a year to set an action agenda item, which I know Oyemi will amplify at the end of this meeting. We're also very privileged to host technical working groups like the financing working group that Leonora leads, the accountability working group that Xochitl chairs, as well as the youth leadership platform. Basically, we're providing the platform and the coordination space for all these leaders to come together and advance a shared agenda. We're also very privileged to create space to help let this whole global network of civil society organizations engage with the civil society representatives we have who actually go to each of the investors group meetings, which is very, very exciting. There are 2 civil society seats and 1 youth seat. Elected members who represent us, the CSCG, and attend each investment group meeting to bring forward our agenda. So we have a really powerful seat at the table. So I just wanted to say that that's one of the contributions we have, is to coordinate and support the leadership of CSCG, which we're privileged to do as an NGO host. I wanted to talk a little bit too about our second role, and this is what Mati mentioned, is that we also have the privilege to sit alongside and support an incredible network of civil society and youth organizations who are driving advocacy and accountability at the subnational and national level. And we had one slide here to show the size of this investment. I don't know if you can move to the next slide. Thank you so much. I want to thank our colleagues from the GFF who actually created this incredible document that I hope you have on your seat here to share a little bit about the size of the investment that the Global Financing Facility is making here and some of the results. But over the past 2 years, this has meant an investment of over $2.7 million in 51 organizations in 28 countries. Something that's very exciting is that 30% of all these are going to youth-led organizations, with almost half of the investments going to youth-focused organizations. You can see here as well that there's a mix of priorities, technical priorities that youth and civil society are advancing through their work, including strong investments in building and sustaining these powerful coalitions that we've been hearing about throughout the webinar. A big focus on strengthening an integrated policy agenda and financing for an integrated sexual, reproductive, and maternal health, newborn health integrated package. Some of our other partners have noted that there are times times when nutrition or SRHR has been deprioritized as part of that bigger SMRN-CH package. And so their advocacy is really focused on keeping that on the agenda. So this is just a sense of the scope and size of this investment. Maybe I could talk a little bit about what we've seen in terms of accomplishments and results. And I think all of my fellow panelists have shared such incredible stories. I'll try to add a little bit more, but I think, you know, in general, I'd say that there are more stories than we can possibly tell on this webinar. One of the privileges we have as the NGO host is that we're sitting alongside our partners, documenting their progress and their results. And so far through that, we've documented at least 49 significant policy wins across this portfolio the past 2 years. So very excited to share some of those stories with you. So again, part of our role is that we provide grant support to this network of 51 organizations in 28 countries, again, provide strong technical accompaniment, but also try to be a listening system. And I think Sochil talked about this, which is that there's innovations coming from these leaders across the network, and where we're sitting, often we're in the position to help kind of broker learning across the network. So a huge part of our role, I think, is really network strengthening among leaders. In terms of the goals and outcomes that our partners in civil society and youth-led organizations have, I think you've heard this beautifully from my other panelists, but one of the commitments that civil society and youth have made is ensuring that women, children, young people, and other groups that are facing exclusion and discrimination, that they are meaningfully at the table and they're shaping health priorities and budgets. And we heard about that happening at the grassroots level, the district level, national level, but also to make sure that that's not a one-off engagement, but that they stay at the table in meaningful and consistent ways to track progress and drive accountability. And I think we heard some incredible examples of that from Shedu, from Tasnia, from Sochil. I'm in Tanzania right now, and so I had the privilege of actually having a conversation a few days ago with one of our partners in the GFF network, a group called Young and Alive Tanzania, and I hope that they are with us on the phone. Similar to some of the stories that Sochil shared, they're using a youth-driven, youth-led community scorecard process to shape health services and build accountability. What they've done is identify a cadre of youth leaders who sort of build their own leadership skills and come together to define what they want and need from services. And then they use a scorecard process with the indicators of quality that they've defined, and they assess how well the health services are meeting the rights and needs of their communities, with a special focus on sexual and reproductive health and rights of young people. And using this, they package and synthesize this youth-generated data. They share it directly with health authorities, but then they don't just release it. What they've started doing is convening these very interactive community dialogues that include youth, community members, including parents, religious leaders, health authorities, and local government, to share and validate their findings, and then generate shared action plans that they implement and track over time. So, for example, most recently, they were just in an area called Tabora, where they led one of these community dialogues that surfaced some really concerning problems around maternal health services. But, you know, when I spoke to Innocent, who's working with Young and Alive, he said, there's also this really powerful part of doing these community dialogues where they're providing accurate information about sexual and reproductive health and rights, but also building people's sense of rights literacy, understanding of their rights and entitlements in their health systems, and creating that space for negotiation, and really also building the social capital, collective advocacy and influence of youth as leaders and resources to solve health problems. A few other examples I'll give. In the DRC, a group called YARH similarly mobilized a group of young people, and they identified gaps in health services, and they created a formal commitment-making process where they got health authorities and other key stakeholders to make commitments to deliver services. And this youth coalition is monitoring and driving those accountability on those commitments over time. Another example, in Nigeria, the Slum and Rural Health Initiative is working with women's groups. They've established women-led groups in 10 rural communities, and these groups are creating this very interesting intergenerational dialogue about women's rights, needs, and priorities. They're bringing together women and girls of all ages who are engaging directly with health authorities to advocate for their health needs and priorities, from adolescents to older women together. And there was a very powerful quote that was shared with us from one of the group members that I'd like to read to you. This is from the Kuro community. She said, "The GFF funded project has given me access to the Chief's Palace, where I address women's issues, an unprecedented opportunity. Now elderly women sit alongside teenage girls, openly seeking advice on personal hygiene and family planning and transforming our community's health priorities." So again, we're hearing, as you've heard from many of the panelists, civil society and youth have this critical role in ensuring the rights, agency, and meaningful participation of women and youth and historically marginalized groups. They ensure that those voices and perspectives are in policy dialogues at all levels. But what we're also seeing is that they're powerfully shaping policies and budgets and even mobilizing new investments in some really incredible, tangible ways. So for example, in Kenya, the Sun Network participates in the 3rd generation Kenya Nutrition Action Plan, regularly providing input on food and nutrition security. In Cote d'Ivoire, FENOS sat alongside the government to develop its health financing plan for SRM and CHA, including vaccination, nutrition, HIV. There are some really important policy wins that have been measured, and I think this, if you look at the great brief that the GFF developed, you can read more about these. But for example, in Kenya, the Organization of African Youth Kenya brought together a coalition of 17 youth organizations. That was spoken about before, the power of coalitions acting together. And they collectively advocated for prioritization of adolescent and youth health. They did a formal analysis of the gaps in adolescent health, and we've seen some incredible results. And let me give a few. I know I need to wrap up. One, they advocated and got the first adolescent health policy in place. So it wasn't just bringing policies perspectives to the table, but really advocating for changes. They were able to successfully oppose. There was a proposition to put family planning service fees into Nairobi's 2023-2024 budget, and they successfully advocated to remove those user fees. So there are many other examples, and hopefully they can come up a little bit more during the question and answer. But what we're seeing is, I think you've heard from all of our colleagues, that women, young people, civil society organizations have this incredibly powerful role of shaping the policies and investments of GFF and really driving accountability with an incredible eye on inclusion, which I think is so critically important. So I'll go ahead and stop there. Thank you so much, and I look forward to the discussion.
Yeah, thank you so much, Christina. I was just enjoying it and I got carried away. I just checked the time. I'm like, wow. But thank you for sharing, the impact of, the GFF support in countries and how you've been supporting civil society organizations and youth-led organizations in countries. Wow, 49 policy wins over 2 years. That's something. Thank you so much. And so we move, because of course we are running behind schedule. We move very fast to the questions and answers. And so we are going to take 3 questions from the room and 3 questions online. So if you're online and you have questions, kindly, use the Q&A and drop your questions there, or just indicate. And then in the room, Sochil, can you help get people in the room 3 questions over there?
There's microphones in these stands over here by the pillars, or Vincent can bring it around to you. So if we can get, I see 1 here, 2, anyone else? 3. Great. Yes, right here, these 2, and then 1 over here.
Good morning. My name is Abimbola Larry Balogun. I'm a lawyer and I'm from Nigeria. I represent WIMAGE, which is Women in Monitoring and Auditing Global Election. And our theme is From Cradle to Power. We're in 16 countries and I represent Nigeria. What I want to talk about, because Christina mentioned the coming together of women and youth, in Nigeria to advocate for, education and equality. But I discovered that in the grassroots, there are some set of groups that are not captured in this equality and education. And those are the girls between the ages of 13 and 15 that gets pregnant while in school, and then the education stops. And once that is done, a lot of them don't even have parents to look after those children for them to continue their education. So we discovered that a lot of these girls stop the education once they give birth. So what we're doing is to help look after those children while we register them back to school so that they can finish their education. So that is very important and is really happening not in the urban, but in the grassroots. So my question is, what are we doing to capture this set of vulnerable girls that are getting pregnant between those ages and the education will stop? While they will be at home looking after the children, the boys or the men are going on with their own education while their own is stopped. So if we're talking about equality and inclusion, I think this set of people, this set of vulnerable groups should be included in, their nutrition for the babies and stuff like that. So in Nigeria, that is what we're looking at in Women, because like we said, it's from cradle to power, because we know that education is very key, especially for the women to occupy the global space. Thank you very much.
Thank you. I think what we should do is just go ahead and take the other two questions if we can, and then we'll go back to online. So I believe you were, and Madame, were you wanting to? Yeah. Okay. So
thank you.
Yeah, go ahead.
Hi, my name is Lauren. I'm a youth representative for a NGO at the UN. And my question is for you, Xochitl. You spoke a lot about accountability and some great tools for the accountability systems that you use in your network. I was wondering if I could have access to those tools, or where we can find those resources to leverage some of your ideas. Thank you.
Absolutely. And then I think we saw one. Oyeyemi, do you have come on up? Do you have questions online? Because we have a few more here in person.
Yes, we have one question online.
Okay, so maybe we'll take this one and then go online, and then we'll do another round if we have time. Go ahead.
Hello, good morning to everybody. I'm so grateful to be here. My name is Aisha Sise. I'm from Sierra Leone. I'm the Said Autism Foundation. I'm representing the Said Autism Foundation. So I have 50 kids I'm helping all by myself. So I come up with this organization because I'm a single mom of 3 boys, and the first one is autistic. So I went back home. I see the way these autistic kids are treated back home. So this is my passion I have to help those kids. And I'm working with some other organization that can help me from grace to power to help them get education, because education is the key. And I'm proud to educate my siblings, brothers, sisters. They are graduates right now. So I want to do more and help those special need kids in Sierra Leone. So I'm here to ask the World Bank or any organization can work with me and move my passion I have for these kids. So what they can do to push me and support me to do what I'm doing right now. Right now, I'm doing the school construction with all by myself. Thank you.
Thank you. Oyeyemi, over to you to guide us through those, I think the one question online, and then how you want us to respond.
Okay, thank you so much, Xochitl. So we have Annette from Kenya says, Kenya is in the second phase of reinvestment. How best do we position ourselves as civil society organizations in the process. CSOs through INET are coordinating our strategic engagements in the process and would appreciate more insights from colleagues here on how best to ensure our productive contribution. Okay, so I would say over to the panelists. Anyone who wants to answer any of the questions. I think this is mostly directly to Mati and Christina in a way. So over to you.
Christina, do you want to get started or should I go?
Go ahead, Mati.
Thank you. Thanks for the excellent questions. I'll try to answer the last one that was just raised by Hennet. Hennet is actually a very good example of CSO engagement and collaboration with the GFF partnership across countries. It's the first country, one of the first countries that joined the GFF, and a lot has been done across several areas of work. And I think Sharon's question is quite important, particularly as Kenya recently received their second round of investment. And it's really, really important that you engage, you stay engaged. And the GFF support through PAI has allowed civil society and young people to shape policies, adolescent health policies, sit in the country platforms, just like I said before, but also make meaningful changes at the county level through the budget advocacy work that you have been doing. So it's really one of the challenges that I see across several countries. It's really around aligning with the government, the government and the partners around those priorities that have been decided at country level, ensuring that because you already have a space in the different technical working group, it's making sure that you know those policies, you understand those policies, but you can also continue shaping them. The alignment is also important across CSOs. I understand that Hennet is a multi-sectoral platform, which is actually really good and useful when it comes to looking at what are the priorities, how can we look at women, children, and adolescents as a instead of siloed approach in a holistic way to address their needs, whether it's in sexual health, reproductive, or nutrition. So Hennet is actually doing well. I would say keep going, keep engaging because you have seen progress, and as we move forward, I think we'll see more. And I'll respond to the second question from the participant from the colleague from Sierra Leone. Listening to your name, I thought you were actually from Senegal because it's a Senegalese name. Really grateful for your question, and I would say the work that civil society is doing at country level is done through the GFF coalitions. These are national civil society coalitions that are well established, coordinated. GFF, it might be called GFF coalition, but it's actually a RMNCHN coalition working across the different sectors, working across social determinants of health. And it's through these coalitions that the advocacy takes place. So it's really, engaging with those coalitions and, looking at what is being done by CSOs in those coalitions. How can you bring the issue of autism? How can you bring, the different issues that you want to bring in through these coalitions so that the advocacy can take place? The GFF doesn't work directly in autism. We support country priorities. So for you to take those priorities to the national level, it has to be done through the coalition in a structured way so that the issue is taken up. And I know there is a CSO group that is in DRC that recently worked on this issue and took it up all the way to the national level. So really, I would suggest that you work and you identify who are your partners in country. And maybe that's the segue for Christina, because through PAI, there is this support that's happening in the different partner countries, and they have direct link with with civil society in country. And I believe it still stands. Health Alert in Sierra Leone has been leading the GFF Civil Society Coalition, and they are based in Freetown. So it would be the best entry point to discuss on these issues. I think I have responded to the two main questions that I think were addressed to me. If there is another one that I did forget, Yemi, please, can you remind me? Otherwise, I'll give you the mic back.
Okay, thank you, Mati. I think you answered. I think there's a lady from Nigeria who was talking about the importance of, not leaving adolescents behind in terms of education. I don't know if you want to answer that.
Sure. Thank you very much. And I'm sorry I missed the question. The GFF works in a multi-sectoral way. We do address reproductive, maternal, newborn child health issues, but we work through different ministries, and we support through this multi-stakeholder platforms at country level in different countries, including in Nigeria. We work across government partners. So it's really addressing the social determinants. It's not just addressing the issues, the core mandate of the GFF, but also looking at those issues. And I know, for example, child marriage is an issue across a lot of countries in the region. When you look at the investment case in Chad, for example, it's looking at how to work with the different partners to reduce child marriage. When you look at some legal reforms that we have invested in, we have collaborated in Niger, in Cameroon, it's ensuring that young adolescent girls who become pregnant while they are in school remain in school or are able to come back to school. So these legal reforms are actually impacting girls' education. So it's not just the investment in service delivery, but it's also looking at the system, looking at the reforms that we can address to ensure that girls stay and remain in school. This is also happening across a number of countries where you have comprehensive sexual education called differently in the country context, which is in line with what the government wants always, and making sure that these young girls, young adolescents do have access to comprehensive sexual education. And just like Christina was mentioning before, 1/3 of our investment is going to youth-led organizations. We have outstanding examples of how young people are actually shaping policy, increasing transparency, working in very simple ways around accountability at the community level, and making sure that this data or the information that they have transpires all the way to the national level. So there is a big focus on adolescent health throughout the most interventions of the GFF, and this is done in a very multi-sectoral, inclusive way, not just with education, but gender and other issues that are really impacting reproductive, maternal, newborn and child health. I'll stop there. Thank you.
Thank you, Mati. So we go to Christina. If you have...
Do you know what? I wonder if I could come in afterwards about the resource and network stuff we could provide. Because we were just talking about adolescent health and rights. I wonder if maybe we wanted to hand it over to Jedu to answer that one, and then I'll come in after.
Okay, awesome. Jedu?
Thank you so much, Yemi. So I want to respond, maybe just to share a bit of notes to the lady who was talking about adolescent girls getting pregnant and sometimes having to drop out of school and being left out. So I want to share that with the Lunia Center for Youth in Zimbabwe, what we have done is we've noticed that even when the girls would have information about accessing services, sometimes the reasons why they find themselves in this situation is because they lack life skills. So what we've done is when we engage, especially the younger girls, we try to incorporate life skills in our session. I'm talking about life skills like communication, them being able to say no and stand to their no, assertiveness, and also, boost their self-esteem so that they are very much empowered, that even when they've gotten pregnant, they are still able to go back to school, because most policies, they now agree for, even for a girl to go back to school when she's pregnant, because the reason why maybe some of these girls do not go back to school is because they are not confident enough to go to their peers and, be seen that they were pregnant. And because these are very young people who still have a lot of issues, they are maybe, their focus is not yet broad. So I'd like to emphasize on the issue of incorporating young people from very vulnerable communities who don't know beyond what are their societies and their cultures puts in their heads. So we have incorporated life skills, and we've seen a lot of change in that, because we now have girls coming back and saying, you know what, now I'm able to say no. Now I'm able to say no, we are going to use a condom. And in return, it reduces the rates of teenage pregnancies, STIs and stuff. So it could be something that they could consider, incorporating in their basic conversations about health, because health is a very personal, and it takes a lot of, self-esteem, confidence, and other basic life skills for a young girl about 15, 16 to be able to stand up. Thank you so much, Christina. Thank you so much.
Thank you, Jeru.
Oh, yes.
Oyemi, should I come in and maybe answer some of the questions that NGO hosts might be able to answer?
Yes, please, Christina. Go ahead.
So super. I mean, I think what I could offer, just building on what Mati said, is all civil society is welcome, and we hope you will connect with your with the civil society or youth-led organizations that are leading and coordinating coalition work at the national level. If you go to the NGO host website, and we'll share all this information there, you can see a list of everybody who is receiving funding and has raised their hand to lead those coalition efforts. You have their contact information to reach out to them. We also have information about all the in-country GFF liaisons are, so you know who your point person is at the GFF. And then just to say, I think Xochitl will get to this, but on that website, you can see webinars, trainings, tools such as the community scorecard tool. It's kind of a clearinghouse for information, as well as connecting with these networks. So I'll leave it there, because I think there's some other questions in the room, but we'll make sure we share that information with all of you after this session, and we welcome any of you to join our work. Over to you, Oyemi.
Thank you.
And-
Xochitl, do you have anybody in there?
Yes, I was going to say, if I can just respond really quickly for a minute, and we have 3 more questions that I saw over here with Marco here and up here at the front. I know we have more, but we are going to end up running out of time. So if we can just get those 3 or 4, 3, 1, 2, 3, and I'm going to go 4. So in that order, if we can go. And then I just wanted to just address really briefly, and as Christina said, we do have those resources in terms of accountability and can share those around. Christina, her team, PAI, as the NGO host organization, and has really been doing a great job of creating the structures for us to be able to share these resources. It is not easy. Sometimes you'll get these resources and see and the information sharing, right? The work that needs to be done in order to actually say, here's the resource that I use and how can I build your capacity, is something that has been really instrumental. And again, the NGO host organization, PAI, has really done a great job in the last few years to help us do that. So those resources are available, and happy to share through that as well. So again, if we can get maybe Marco here, sir, and 4 up to the mics. Thank you.
Hi, this is Marco from Vemos. First of all, thank you very much for these very concrete experiences. And I appreciate immensely the work that the GFF is doing for community engagement. Before working as an advocate, I worked as a medical doctor, and I definitely agree that community engagement is incredibly valuable primary healthcare. So last year I was in Chile, and I visited a primary healthcare facility as a government center, and I was struck by the fact that community engagement there was like systematically done in order to guide decision of the facility in terms of budget, programs, etc. And this was not like a World Bank program. This was part of how the public system works in Chile. So I'm saying that because I don't think the plan is that the GFF is going to be around forever, but community engagement will be important 20 years from now. So my question is, and I guess it's mostly for Matti and Christina, is that a plan to make it an integral part of the healthcare system, this community engagement, with a long-term vision also after GFF programs are finished? Maybe that's a bit of a naive question, but I'm very curious to hear that. Thank you.
Thanks, Marco. Up here at the other microphone. Sir, if I can have you come up here. And we still have a few minutes, but if we can make them short interventions. Thanks.
Oh, hello. Hi, I'm James. I'm from United for Global Mental Health. And I'd be interested in those on the panel who are working with youth-led organizations or directly with young people and young parents about how much is mental health coming through as an issue that those people are concerned about, and how well do you think that GFF money is responding to that? We often hear from the GFF that the GFF is country-led, but in reality we know that the framework and parameters of what can be included in investment cases is set by the Secretariat and is set by the investors group in some to some extent. It is a dialogue. So is it an issue, and how well is that financing responding to it?
Thank you. Go ahead, sir.
Yeah. Hello. My name is Abi Karim Habib from Sierra Leone, Executive Director, Network Women for Democracy and Human Rights. My concern here is action-oriented strategy for so much of our social protection support being given to government, but the social accountability, the work that civil society are doing is lacking. And how will that, maybe the bank will start to look at maybe a few percent to give to civil society so we can be able to effectively monitor what government is doing, and it's lacking. I've said this and I'll continue to say that it's really lacking and nothing is happening. Thank you very much.
Thank you. Here.
Hello. I'm from Gallaudet University, and I just wanted to know, do you guys provide any access for people with disabilities? When you talk about diversity, is disabilities included in that diversity?
Thank you for the question. Oyemi, over back to you.
So we go directly to responding to how well is the mental health being mainstreamed in our interventions. So who wants to go? I think we could have Teju, because it's talking about interventions to young people and all of that. Jedo, do you want to go? And then if any other person on the panel also wants to add to it, then that's fine. Yes. Over to you, Jedo. Okay. Jedo, are you on the call? Okay, so does any other person on the panel wants to go?
Yes, Yemi, I can take some of these, and it's unfortunate that Chedu is not on the anymore, because she does actually address mental health in the ZIM coalition, and it's not just Chedu, but I know of a lot of projects, and Christina can speak more to those as she's monitoring these closely. A lot of projects that are youth-led or CSO-led integrate more and more mental health, and this has actually increased in the last 2 years. And I guess it was already there, but with COVID, adolescent health and adolescent mental health especially has been back on top of the agenda and discussed. So this is something that is there and integrated, right? Again, we do not support single issue diseases. We support diseases, and issues that are addressing people as a whole. So this is one of the added value of the GFF, and this is addressed through the support that is gone through PAI. And again, it's not something that we decide, it's the CSOs at country level through the CSO coalitions that have action plans that are consultative, right? It's looking at among the different CSOs, what are the priorities that we see? Which priorities do we want to advocate for? How do we make sure that these priorities are put in a proposal that is sent through PAI and funded? So this is definitely the GFF is addressing these issues. The channel differs, whether it's through the GFF World Bank supported project or through the CSOs. The second question, I'll go back, sorry, Marco, thank you very much for your question. The increase in community engagement in the last few years that I've been engaged in the GFF through different hats has shown us that this is something that that is coming from partners at country level, from CSO partners. There is a real interest in working in these issues and moving from the national, because we've seen a lot of progress happening and a lot of cross sharing also. That's something that I forgot to say, but that's one of the added value of this of the civil society coordinating group, the CSO constituency of the GFF. There is a lot of learning around community engagement, which takes different format, and around accountability. You can speak to Xochitl, who can share more around that. So whether this is something that is going to be standard, I don't know, because it's again coming from the countries, coming from the partners. They decide what issues they want to focus on. One of the things that we are aiming to do is really, as I said before, mainstreaming CSO engagement, citizen engagement in our project. It is happening in a few countries, and we are hoping this is the direction we want to take, so that it's embedded. But it's again not for the GFF to come and decide that one investment case is going to only focus on community engagement. It's really increasing the way we work with and collaborate with CSOs who in their countries can decide whether citizen engagement with partners is going to be part of their national priorities. Going back to the question that James, I'm sorry, we do have the investors group, which is, for those who are not familiar with the GFF, it's the board, it's the governance board of the GFF. The investors group has country representatives, ministers. So it's not, yes, it's country-led. And when we say country-led, it's really the countries that are deciding. It's not the GFF secretariat that decides on those priorities. We provide support, we facilitate, but we stand behind countries. And I just want to reiterate that. We stand behind countries' priorities, and we facilitate the mechanisms with countries, but also with partners through the alignment work that we are leading across a number of countries. Abdul Karim from Sierra Leone, thank you for your question. Social accountability, the work is actually increasing, not just for the GFF, but for the World Bank. Through the Global Partnership for Social Accountability, the GPSA that is hosted in the World Bank, there are many social accountability projects. But again, there is a process to get through this, to get to this funding, and PAI is the channel that has been facilitating this process for civil society and youth. And lastly, the question of access and disability. There are many projects, and just recently, one of the outcomes of the JLA, the Joint Learning Agenda, which I just recently heard about, is the inclusion in some of the investment at the district level, at the decentralized level, inclusion of albinos, young adolescent girls who are albinos in Senegal, who are actually not receiving access because of stigma related to albinos. And there was some dedicated funding to make sure that not only it took education, but also increased access to services to this really vulnerable community. I know the Malawi CSO working group is also working with disabled adolescents and disabled young women to allow them to have access to reproductive health services. So this is happening. Again, the GFF is very, very young, so we are learning and sharing, getting those experiences, but also CSOs are sharing experiences across countries so that there is more, we can build on what works, really see how it works, and then make sure that we put the investments, resources, technical, but also financial, to support this agenda. I believe we're at time, so I will stop there. I hope I've been able to answer some of your questions. Thank you.
Christina, are there questions you wanted to address?
Oyeyemi, are you on?
Yes. Christina, can you hear me?
I can hear you.
Okay, I think it might be in the room. It's very hard to hear, so if you can speak up.
Okay. Christina, if you have any response to any of those questions, you can just say that in 1 or 2 minutes.
I will be very, very fast, because one thing, one of the shared asks for the CSCG, and I think Sochil may not be able to comment on this, but I think she'll agree. We are calling for institutionalization of community-led monitoring in health systems as a non-negotiable part of equitable inclusive health systems. And that is a top ask of the CSCG at the global level. It's reiterated through our engagement in global spaces, and many of our partners are both implementing it and trying to institutionalize it at the national level. I think I'm going to wrap there. I'm sorry we weren't able to answer all the questions, but I did want to hand it back over to Oyeyemi, because she is going to present some calls to action on all of our behalf that I think summarize both the themes you've heard on this panel, but also the shared action agenda we developed as CSCG in November. So with your permission, Oyeyemi, I think I'm going to stop there and hand it back to you.
So I'm just going to ask one question round, for all of my panelists. Just 1 minute for each person so that we can round off this session as we go. Okay. So for Teja, for Mati, let me start with Mati. So Mati, finally, what commitments or actions do you hope to emerge from today's dialogue to sustain and further strengthen the partnership between CSOs and YLOs and the Global Financing Facility for the Betterment of Health Systems in GFF partner countries? Over to you, Martin.
Thank you, Yemi. I think the commitment I've said already, it's really, making sure that civil society's work, CSO engagement, is mainstreamed in the core business of the GFF. That's one. The second, which is a commitment, but I think it's a commitment to collaborate more, to gather data, to gather impact, to show that this works. And this is a commitment that we take in supporting, working with civil society and youth organizations, and supporting them to make sure that we have a case, we build a case for CSO engagement to continue resourcing, because it's not just the GFF. We're working with the government, but we're working with partners. So it's just showing the value add of CSOs. So to do this, we need data, we need impact, we need stories. And this is a commitment that I take as we end this discussion. Thank you.
Thank you, Marty. So we are definitely the end schedule. So I would just love to take a call to action, right? Because this is very important to us. So as civil society organizations and youth representatives, we urge international community to invest in the GFF to strengthen health and nutrition systems, transform lives, and deliver the future. We call on all GFF stakeholders to establish accountabilities that ensure CSOs and YLOs have meaningful roles in decision-making about health and nutrition policies and budgets, including GFF multi-stakeholder platforms. We call for continued investments to strengthen and deepen CSO YLO's capacities in budget advocacy and health financing monitoring in order to unlock new domestic resource investments in RANCA plus N. We finally call on GFF donors to invest in predictable multi-year funding to sustain effective community engagement and civil society and youth-led advocacy and accountability. You can just go to our website. There's a link, and I'm sure we dropped a pamphlet on the chairs where you see all of our call to actions. I want to say a big thank you to everyone for joining in this call. It's been a beautiful, beautiful conversation, and we must say we really appreciate you. Thank you, everyone, for joining in the conversation. Kindly go through to our website. And, thank you.
Thank you very much for the invite.
Thanks, everyone. Thanks, Oyemi and everyone. Great conversation.
Thank you so much.
And you do, as Oyemi said, do have on your chairs that call to action and also the background report as well. Thanks.